Hi everybody, sorry for the delay in joining the webinar for today. We're all on board now, so thank you for joining. Today we are going to be discussing and learning about how to ace your CQC interview. So we'll be having some tips about how to do your application forms, what you to expect in your interview. And my name is Victoria. I'm from Smart Health Compliance. Some of you may have watched our webinar, so we've done a Q&A series before. I know a lot of people from Domiciliary have watched that. It was more aimed at dental, that particular webinar, so we thought we'd do one especially for you guys and just discuss kind of what to expect, what help is out there, what's available, and just get you more prepared and feeling a bit more confident. So the aims and objectives for today's webinar, just to understand the CQC application process, the requirements, learn how to prepare your supporting documents, that's really important, and what evidence you're going to need. Develop some key interview skills and techniques. So we'll talk about what to expect in the interview, but just how to maybe overcome any issues that you have maybe with confidence, how to talk about or give examples about things you do on a daily basis, and just make the whole process a little bit smoother and a little bit easier for you. And yeah, we'll give you some tips for a successful CQC application and interview. So to start with, so it might have been a big dream of yours. You may have been wanting to start your own domiciliary care agency for some time. And first of all, what you need to do is you need to register with the CQC. So with the CQC, what they'll expect is that you're going to make an application, and with that application, there's going to be a lot of supporting documents that will need to be attached. Some of these will be to assess your fitness. So what experience do you have? What makes you fit for the job? Other things might be, what policies do you have in place? What procedures do you have in place? And of course, you're going to need a statement of purpose. So that's talking about yourselves, what you will do, talking about the demographics of the area, what systems you put in place. You'll also need a business plan as well. So the good news is, we can help you develop all of these policies. We have a system, it's called Smart Healthcare Compliance. You can actually subscribe to us, and what we can do is we can help you with templates, we can create your policies for you, we can actually even complete the application. We get a lot of people, they call us and they're really stressed. They've tried to do the application themselves, or they've used a different company. A lot of people, they pay a lot of money for policies. I've had some clients, they're paying up £2,000 for like 5 policies. It's a lot of money to spend as well. So what you can do is you can give us a call, and we can just talk about making a bespoke package for you, and we can talk about what policies you need, what procedures you need. We can help you generate statement of purpose. We can actually help you with the application. We don't just do that, we actually help you with the interview preparation. So today we'll touch a little bit about what to expect on an interview, but we do have a service where we can mentor you, we can do mock inspections with you, we ask you questions, we ask you for examples, or just make you think a bit more about what you do on a day-to-day basis and make you feel a bit more confident in discussing it in an interview. So at the end of the call, even in the chat box, just pop in if you do want like a chat with us, just to see how we can help you. We're here to help, that's what we do. So as mentioned at the start, what you're going to need is the application. So you might have contacted us, or maybe you've done it yourself and you've got all your policies and procedures in place. Some of the key things that you're going to be needing to include are going to be infection control, medicine, safeguarding. Sometimes it can be difficult to know what exactly needs to be within the policy. If you are using a company and they are making the templates for you and you're submitting it with your application, make sure that you review all the information that is contained in that document, because during the interview process, you will be quizzed on that. So you don't want a generic copy and paste policy. It does need to be customized to exactly what you do. So think about what you do, add in some bits and bobs that are just key to what you're doing and what make you, things that stand out and show that you do know your job. You do know your job, you do it day in, day out, but just please review the policies. A lot of people, they come to us, their applications may have been rejected, and that's because the policies that they have submitted aren't actually relevant maybe to domiciliary, or they got them from the internet, or they paid somebody who doesn't maybe understand the different policies and procedures that are needed for your sector. So do review them. The worst thing you want to do is submit all the evidence, all of your policies, procedures, and then the CQC reject it, and you've paid all this money for them, to review it before you do the application, because there's nothing worse than, it takes a while as well. So it could take maybe like 8 weeks, 12 weeks, and then they tell you, oh, actually, this isn't sufficient enough. So you've wasted all that time. So whether it's us or whether it's somebody else, always get somebody to kind of guide you, and just have a checklist in place as well. So do you have the policies that are required? Do you understand the policies? And we can talk about that a little bit later. Then obviously you're going to have your interview. So you've done your application, you've sent it to the CQC. The CQC have reviewed it. They're like, wow, amazing, you've got everything in place. The next step is the registered manager interview. Obviously, as I've mentioned, you're going to want to review your documentation just as the inspector would have, because they are going to quiz you on it and make sure that you understand what you've submitted. And then they're going to ask you a series of questions. And these questions, they're effectively to make sure that you understand the key lines of inquiry. When we talk about key lines of inquiry, we're talking about being safe, effective, well-led, etc. So what you need to do is you need to showcase your talent, showcase your experience, and just talk about what you do on a day-to-day basis anyway, and how you are going to ensure that whether it's your clients or your service users, how they will be safe, whether that's the recruitment process, so you're making sure that you're safely recruiting staff, that you're doing risk assessments to ensure that your clients or the individual is safe. It's a really big it's a big thing to look at. So when they say safe, it's not just a one-word answer. You need to think about what you're doing and really just think about what makes things safe. So during the interview, these are kind of like the main key areas that they're going to have a look at and review. So we've already touched a little bit upon it, but staffing and recruitment. So they're going to ask about your recruitment and your training process. Even now, whilst we're on the call, have a think. So what do you do for safe recruiting? Some of the things that you would have done or that you would plan to do is maybe check that all your staff have DBS checks. Another thing that you might want to do is make sure that they have the relevant training to that job, the qualifications. Now, domiciliary, the people that you hire, they need to have compassion. You want to treat your service users with dignity and respect. So you're trying to hire the correct people, but you're going to want to do a lot of background checks as well to ensure that your team are the right team for the job. They represent you, and essentially you can be registered, but if you've got the wrong team, your team could let you down. And then when it comes to your next inspection, perhaps you're not going to get those kind of outstanding reports from the CQC inspector. Another thing that you're going to want to think about is the care planning and delivery. So they'll expect you to have an in-depth understanding of how you plan and deliver care. So you need to think about what you have in place. So are your care plans like really detailed? Have you got the individual's details, but also the family's details, so you can contact them? You want to make sure everyone's involved in the care that the individual is receiving. So small things like making sure you have the relevant contact numbers, even down to preferences of the individual. So they might like apples, but they only like to eat the apple if the apple is chopped. So it's about really taking care of your clients and making sure your care plans represent that and reflect that. Another big thing that they're going to look into is safeguarding. Obviously, you're going to want to have a safeguarding lead. We're not just talking about safeguarding the individual, but you have a responsibility to safeguard your staff. So you'd want to make sure that everybody's had training in whether it's being harmed maybe by the individual. Of course, you're dealing with people from all walks of life. Some people might have behavioural issues. So it's making sure your staff are well trained. It's about talking with other people. So whether it's GPs, families, all working together to make sure that the individual and your team are safeguarded at all times. Another really important thing to consider is complaint handling. So we say complaint handling, but this could even be part of your feedback process. So that's getting feedback from the client or the individual that's receiving the care. It's getting feedback from the family members, and it's just about learning and improving. So when we talk about complaint handling, you should have a complaints lead. So everybody should be aware of who they should report to. This should be in your statement of purpose. This should be in your complaints handling policies as well. And essentially, you want to be open and transparent. So if you are getting complaints, don't hide them, don't brush them under the carpet. It's a learning curve, and everybody should learn from that complaint. So we want you to discuss it in meetings. We want you to have a clear process and outcome. How will you prevent this? How it's essentially about being well led and being effective. So when we talk about the key lines of inquiry. Moving on from there, so when it comes to the actual interview, so some of the like key areas or the common questions that you'll be asked, they're going to include like, how do you monitor staff performance? So be prepared to discuss how you monitor their performance. So this could be with appraisals or doing annual reviews or just checking in with your team. You want to talk about how do you promote a safe environment. So when we talk about safe environment, this could be things like doing risk assessments. So risk assessments of the client's home, and make sure there are no hazards in place. These are things that you want to look at. So you should always have a plan of how you're going to monitor and how you're always going to improve the care you're providing. And one of the biggest things is going to be auditing. Otherwise, you wouldn't know what's going on. So this could be auditing in terms of auditing your records or your care plans, and this could be things like auditing the safety of the individual's home. They're definitely going to talk to you about promoting dignity and respect. So you need to think about, how do you as a company promote dignity and respect? How are your individuals included in their care plans? This is a really big one. So do spend time to reflect and think about how you do this within your domiciliary care. Another one will just be about, how do you meet the standards? So we've already talked about the key lines of inquiry, but the way that you'll do that is just making sure you have the necessary policies, procedures, risk assessments in place. So the only way you can meet the standards is if you have a clear evidence-based tracker of what you're doing. So we have, like I mentioned, we have got a system in place. It's called Smart Healthcare Compliance. And what we've done is we've created every template that you need to ensure that you've got your policies in place, you've got your procedures in place, you've got your risk assessment. But we've also broken it down into what things are mandatory, what are recommended, the frequency in which you need to do them. And we've made it so simple that you can actually use an e-log. So you'll have a calendar. On the calendar, it will show you what you need to do. You click the activity, complete it, and it gets saved. That way, you've got clear evidence that you are actually maintaining CQC requirements. And should you get an inspection, this is what the inspector is going to want to see. Now, with domiciliary, obviously, it is quite a remote, so you don't go into an office every day. We're not all in the same building. So it's a really good way of having a remote digital system where you can all communicate together. You're all on the same page. Your staff can update or read policies remotely as well. And you've got like a hub of all that information that you can share with the CQC or share with your staff. Or even if the service user's family, for instance, wanted to see evidence that you're doing it, you've got that all stored and tracked. So what I'll do is I'll share my screen with you. I'll show you a bit about how Smart Health Compliance works, and then and you can just see how helpful it is. It does help you in terms of the CQC interview process as well. So you can imagine when you're having your interview, you'll be talking a lot about the risk assessments or the policies that you have in place. And having a system like Smart Healthcare Compliance, you're proving that actually you're taking this really seriously. And look, I know that every 6 months I have to do these risk assessments. I have a clear plan in place. And then at a later date, when it comes to being re-inspected, you've got the evidence that you've done this prior, but you've also got like a plan ahead that you're going to be taking out these kind of risk assessments or all types of compliance tasks, and the inspectors do like it. So I'll just pop over to Smart Health Compliance and I'll show you a little bit about how it works. What I might do is I might go back to that a little bit later because the system is blocked me out, but also, if you do want to have a demo with us, do contact us and we can get that set up and we can show you. So now what I'm going to do is I'm going to enter Saba into the chat. She'll ask me some questions, and what we'll do is we'll try and answer the questions as though we're in an interview, just to give you a little bit of idea and a bit of preparation work. So Saba, are you there?
Yes, I'm here. Hi.
Amazing. Hi Saba, how are you?
I'm good, Vicky. How are you?
Good. Thank you very much.
Hope everyone's doing well and enjoying the webinar so far. I'm definitely learning a lot.
Thank you.
Perfect.
So Saba, I know in our previous Q&A that we did for dentistry, I think the roles were reversed, weren't they? And I asked you some questions, you did the answers. So I'm in the hot seat today. If you can just ask me maybe like a few questions,
Sure,
as they would expect to hear when they're in
Yeah.
their interviews. I think it's very helpful. And of course, just to let you know that we do offer a service where we do mentor you, and then you can kind of get more questions, more answers, more examples. So if you feel like you're listening to this and thinking, oh my God, I didn't know that, I don't know where to start, please do just reach out to us afterwards and we can help you. That's what we're here for.
Perfect. So my first question is, Vicky, how do you ensure the safety and well-being of clients in domiciliary care?
Sure. So I have a rigorous recruitment process. So before I hire anybody, I make sure I've done the relevant checks. So I'll check that DBS checks, there's no criminal record, and that the person I'm employing is safe to work there. I'd want to make sure they have the relevant qualifications as well, so that they know what they're doing. I want to make sure that they are, as I mentioned before, that they want to deliver high quality care just like me. So I'll be looking for qualities in them that show that they are empathetic, that they will treat my clients with dignity and respect. I'll put training programs in place myself. So I'll offer my team CPD. I'll be using the Smart Healthcare Compliance platform as well, where my team can do CPD that's relevant to the role. So whether that's like mental capacity training, whether it's anything that needs to be done, or if it's areas that I feel they need a little bit more work in, I can direct them to the correct CPD. I'll carry out risk assessments as well. So I want to identify potential hazards in maybe the individual's home. I want to establish protocols and reporting systems. So again, I'll use Smart Health Compliance to report any issues. So whether it's a safeguarding issue, whether it's an accident or an incident, I would keep all of that logged, and I would obviously want to learn from that and ensure it doesn't happen again. A key thing would be ensuring that I've got personal centered care planning. So I'll make sure that the individual care plans are catered to them. I'd involve them in their care plans as well as the families, and I'll touch base with maybe local authorities or GPs as well.
Okay, that sounds great. I mean, you've given a very thorough answer, and you've given a lot of examples of how you're going to do things and what are some of the things you're going to do. So that is amazing. Thank you very much for answering that question. I'll move on swiftly to the next question, which is, how do you promote a person-centered approach in its domiciliary care?
Sure. So that is like core to the service that we deliver, and I'd want to actively involve the client. I'd want to actively involve the client's family. I would speak to other professionals as well to get a better understanding. I would think about like flexibility and adaptability as well in their journey, because things can change. So perhaps their health deteriorates, perhaps the way in which they want things to be done changes. So by regularly reviewing their care plans, I can see where changes need to be made. I will communicate and I would give feedback to the family as well as the individual. So if I notice any changes, I'll ensure that these are recorded and then fed back to all relevant parties, whether that's my team, whether it's the family, whether it's the individual, and I'll ensure that the care plan reflects that as well. So should it be that somebody else is taking over the care of that individual, they have a clear indication as to any changes that have been made, and that they can deliver the best care for that person as well.
All right, that's great. Thank you very much. That gives me an insight to your understanding about what is, patient-centered approach in domiciliary care. And this is one of the most frequent questions that is asked at the CQC inspection. So thank you very much for the detailed answer for that. So I'll move on. My next question is, how do you ensure that your clients' privacy and dignity are respected?
Sure. So we promote open and honest communication. So whether that's between the staff, whether that's between the client, it's something that we promote, and we're always looking at maintaining the individual's dignity and respect. Ways that we might do this, it would be being discreet and respectful of the client. So for instance, people can have accidents. It might be that a lady maybe needs to be told to like come along to the toilet. So maintain the dignity and respect of that person rather than calling them out in front of everybody. Oh my God, you've had an accident. So it's things like that. It's empowering the independence of the person as well. So I want to, as much as I can, ensure that their independence is still kept. So I'd want to do an assessment of not trying to take away the independence for them, and not just assuming that the person doesn't have the ability ability to do some things. So that's how I would want to maintain some dignity and respect for the care user.
Is there any audits you would do, or do you have any policies on this, or?
Yeah, so on smart healthcare compliance, we do have policies and audits, and some of the things that we'll be doing is like looking at the care plan, and we'll make sure that the staff are obviously well trained in doing this, and we have CPD as well. So some of the CPD that we have is all centered around dignity and respect for our clients.
Oh my God, that's amazing. So my last question, can you provide an example of how you maintain accurate medication management processes, including storing of medicine, what medicine you would be administrating, how would you do the record keeping, what policies and procedures would you have?
Yeah, sure. So a lot of it would be about the storage of the medication. So I'd want to make sure if it's like if the temperature needs to be maintained at a certain level, that I have checks in place to ensure that that is happening. I'd want to make sure that my staff are trained in giving medication. I'd want to make sure that I am liaising with the GPs and other health providers to make sure that the dosage that we're giving the client is accurate as well. We wouldn't want to make assumptions that that's what they need. We'd always check with a healthcare professional as well. The training and the competency of my staff would be like very, very important. So I'd just want to make sure that they understand medical management as well. Again, I would make sure that they're doing CPD. Myself, I would carry out audits. So I'd make sure that the medicine audit is being done, and I'd make sure I have a very good stock management system in place. That way I can ensure that the expiry date, that things aren't expiring. I can make sure that they're being used in time and they're being stored correctly. Also in the care management plans, I would make sure that all of my team know to make sure that they're giving the medication at the correct times, the correct dosages. And then I would also do audits as well to check my care plans to make sure that my staff are doing that accurately.
Smashing, thank you so much. I was going to actually ask you about what audits and logs that you would do, but you've already covered that.
Amazing.
So thank you so much for doing that.
Thank you very much. Any things that you would, any feedback that you would give, Saba, on ways that you could change, or any other examples that maybe?
No, I think that you were, number one, the way you answer the questions, you were very confident. And that's one of the main thing that you need to make sure you are when you are at a registered manager interview, because I know it's very, very easy to get nervous. You know, everybody does. I would as well. But you need to make sure that you come across very confident. Also, one of the things I would highly recommend is like to our lovely, you know, participant is, if you're not sure about something, just ask again. Just say, please, can you repeat the question? I'm not quite sure about this. But as you guys saw that Victoria gave some really good examples. She's using the terms which are loved by the CQC, things like audits, policies. She's got logs, and she's constantly talking about staff training, which I think is very, very important, because CQC needs reassurance of how you're going to train your staff. What are the training things that you're going to put in place? Also, Victoria touched about care plans, which are very, very important for domiciliary care. So again, well done, Victoria, for touching on the care plans, the way you explained about training and how you would manage your audits and logs, and there's HR, my staff, activity calendar, and stock management. So everything is all over here, and it's very, very easy to access it. So one of the first things that we would do is sit down with our clients and get them to fill out something called the initial compliance health check form. And this basically asks you various questions of what are the policies and procedures and the audits or the risk assessments you have in place. So as you can see, my one's already set up, and I've got some activities on my activity calendar. And when I click on these activities that I'm supposed to be doing, I can download the fire safety audit, I can complete it and upload it back onto the system. The other good thing about these audits or the e-forms are that you can delegate them to someone. So I can delegate this across, or I can even customize this. So if I go to customize again, sorry, my voice is echoing slightly, so let me just put the volume down. So if I go to customize event, I can add here. Vicky, I think you just need to mute yourself. So if you mute yourself, that should be fine. Okay, so if we go back, so over here, you can add your own questions if you wanted to, but as I said, the best way is to download the actual file that we have attached on there, complete it and upload it on the system. We've also got things like data protection, risk assessments. So what the system does is it accurately prompts you of all the activities that you need to complete on a daily, weekly, monthly basis. And it's a very good system because it's all color coded, which basically means these are the most important things from a CQC point of view that you have to do. And the blue ones are something that you can create yourself. So if you wanted to create a clear plan audit review, you could do that yourself. From the top over here of the activity calendar where you go to add event. So it allows you to create your own audits, your own logs, your own risk assessments as well from the activity calendar. We also have a compliance template. So whether you are in need of any policies or any audits, any guidances, any risk assessments, any checklists with the other compliance systems, that's something that you have to buy separately. They just provide you with the blank system and then you have to pay £179 plus something in order for that. But with us, it's all in one. You've got everything all under the one roof. We then have my upload. So my upload is where everything you complete, so you can see all my audits that I've completed from the activity calendar are all here nicely presented in the folder. So if you ever get a CQC inspection and you need to present policies or your audits or risk assessment, you can always use the search icon to search what you're looking for and send it across to the CQC. You can download it, you can print it. That's all over here as well. If you wanted to upload any files, you can upload any further files as well. So if you had any previous policies, you can upload that as well. Okay, so that's all over here as well. The next thing we have got is CPD courses. So your whole team will have access to plenty amount of CPD courses on here, and they're all for like domiciliary based. We've carried out an extensive research of what are some of the CPD courses that the CQC want, and you can complete them all over here. They're all verified CPD courses, and we tend to add like at least 2 to 3 CPD courses every single month on here, depending on, you know, how much backlog we've got. We also have HR management. HR management is my favorite platform because it allows me to manage my staff members and organize them as well. So every staff member would have a file over here. And if I go to, for example, my file, you'll see that I've got my training where I can upload all my training certificates. I've also got recruitment where I can upload all the recruitment paperwork, read and sign policies, which has been delegated to me by my practice owner, meeting minutes, MHRA alerts, additional documents, private folder, and onboarding. So everything is all very nicely organized on the system, and it works really, really well. It can really help you to organize all of your compliance paperwork and be ready for the CQC inspection. And obviously, if you wanted an in-depth demo, this is just a quick overall view of what are some of the features and how you can use it in order to pass your CQC inspection. But if you wanted, sorry, I think we just need to, there's a bit of disruption, so let's just go to muting everyone. Okay, so if you do need an in-depth, demo of the smart health compliance system, that's something me and Vicky can arrange for you. So that you can have that. That's not a problem at all. So I just gave you like a really quick overview of everything. So I would now pass it over to the lovely Vicky, who will go through the summary of the webinar.
Okay, thank you so much, Saba. Yeah, sorry about the technical issue. There's always a technical issue. Doesn't matter how many times we do these, and we do these maybe twice a month. There'll always be. But appreciate your patience with us. So thanks a lot. Just as a little bit of a overview of what we've gone through, and what I did want to do is as well, I wanted to share a free download that we have for anybody that's attended the webinar. So if you are interested, I should be sharing my screen. You should be able to see the free guide that we've got. So it's really, really helpful. What it does is it just breaks down all of the interview steps, what to expect on the day, what documents to review, questions to discuss, and evidence that you might need as well. We've got 9 top tips for a successful interview. And then what we've done is we've actually broken down questions and answers for you. So we've asked frequently asked questions, and then we've given you the answer, but we've also given you really in-depth examples of how to answer the questions and how to think about how you do this yourselves in your day-to-day kind of clinical or your care home domiciliary background setting. So it is really, really handy. We do have a lot of our clients that do request this, and they found it really useful. So if you do want a copy, just pop in the chat and we can send that to you. In terms of getting a demo, again, do reach out to us. We can show you the system in a bit more detail. Or if you're at the early stages of your compliance journey, what I would say, if it's something that you're thinking about, then give us a call. The reason is we can make sure that you've got all the correct documents in place. So when you are ready to start your application, you're not having to gather lots of information. So things that you can do now, if it's something that you are definitely thinking about, is you can get your DBS check done. So that's going to need to be a clear DBS check that's done in the last 12 months. So that's something you could start on now. You could start gathering all the information about what you've been doing since you were 16, because they're going to want to know what you've been up to. They want your employment history, any gaps in your employment. Think about what makes you fit for the role. So any training that you've done, any certificates you've got. Start putting these things into place, and then it can be a bit daunting. The application form itself, you open it, you think, oh my god, where do I start? Just give us a call. We do these day in, day out, so if you do need assistance, please do contact us. Before when you start thinking about your policies and procedures, don't rush because somebody said I used a guy and he charged £2,000, but I got everything in time. I'm seeing myself that some of these documents aren't actually accurate and they are being rejected. So please do, just seek advice. We're not saying that you have to sign up with us, but at least we can give you a bit of guidance. Then if you do decide to use our templates, obviously that's just a bonus. Once you have got the application has been processed, then do start practicing your interview. So whether that's a colleague or somebody within the business that can help you do like a Q&A, or if you want us to help you, we do offer that service. So contact us, and what we'll do is we schedule some remote calls, we give you a bit of homework to do as well. So if there's areas that we think that you could maybe improve your knowledge on, or perhaps your answers aren't as clear as they could be, then we'll give you a bit of feedback. We'll come back to those questions and then we'll ask you some more. And we'll keep doing that until you feel confident and ready. And I've seen myself that the people that are opting for this service, from the first call down to the last call that we've had, the improvement in them and just the improvement in their overall confidence has been really, really nice to see. We're not here to tell anybody off, so we don't say, no, you got that question wrong. Well, why would you say that? We're actually here just to help you. We're here to hold your hand and make sure that you're confident and happy, and when it comes to the interview, it's stress-free. So even if you think that maybe your knowledge on CQC or knowledge on policies and procedures isn't up to scratch, reach out to us. We can offer you some guidance in that as well. The system itself is fantastic. So if you're new to compliance, definitely get it. If you're not new to compliance, definitely get it. The reason is the CQC is going digital, so the way in which they'll inspect is going to be changing. It'll be a lot more touch-based calls, drip feeding information to them. Having a digital compliance system just means that you can share the evidence quicker. The more evidence you can give, the less likely they are to inspect, because they'll be happy with you. So the idea is that having a system like this in place, it manages your compliance, and also we will review that with you. So if we see there's areas that maybe you're not doing, the system itself will prompt you to complete these tasks, but we'll also reach out to you, because the idea is we want you to be doing your best, and we're here to guide you and support you. So we don't just offer you a system and then just leave you to kind of get on with it blindly. We try and give you 24-hour support as much as we can, and we're always here to help. Any kind of, we really like your feedback as well. So if there are CPD courses that perhaps you'd like to see on the platform, you can always just reach out to us, and we always try to improve the system. In terms of the webinar today, thanks a lot for joining. And then if there are any questions that you have, or even there's areas that maybe you want to see a little bit more about, or want us to delve more into, or you've got questions, or you had a friend that had an inspection they didn't pass and they said, they spoke a lot about this area and I'm not too familiar about it, reach out to us and we'll try our best to answer your questions. That's what we're here for. Hopefully we'll get some of you on our next webinar. We do concentrate a lot on the dental sector at the minute, so we do a monthly webinar, but we are going to be introducing a lot more domiciliary based webinars, just because we'd love to help you a lot more. We've seen that a lot of domiciliary care providers have been watching our dental ones, so we thought let's do something especially for you guys. Otherwise, yeah, thanks a lot for joining. Again, apologies for the technical glitch. It can't be avoided, but I appreciate your patience with us. And then, yeah, if you need anything from us, you can always give us a call, drop us an email. Do check out our website as well. It gives you a bit more of an idea of how the system works. It might be in the near future, we might look at doing some workshops, so maybe some CQC workshops, especially catered for domiciliary care providers. So if you think that's something that would be useful to you, your friends, reach out to us and we can think about getting some events in the book as well. But otherwise, thanks so much for joining. Those of you that have been chatting in the group, we will get back to all your questions. Anybody who requested the Guide to Successful CQC interview, we'll make sure you receive your copy of that as well. And yeah, thanks so much. I hope you enjoyed it. I hope it was helpful. Again, sorry for the technical glitch, but if you need anything, do reach out.